Hello, I'm Noah Levine, Editorial Director with Dental Products Report. Today I'm joined by Wardah Inam, PhD. She's CEO of Overjet AI, as well as Robert Faiella, DMD. He's the Chief Dental Officer of Overjet, as well as a former president of the American Dental Association. And they're here to talk to us a little bit about AI in dentistry and what Overjet is doing. So to start off, I just want to ask a little bit about the Overjet AI story. Why AI? Why dentistry? And why are you doing what you're doing now?
Yeah, so it started basically, I changed my dentist, and that's how the story starts. The new dentist I went to gave me a treatment plan, which was different than what I had received before from my previous dentist. And that got me interested in the complexity of diagnosis in dentistry and all the things that were involved in it, and started looking at how do you read dental x-rays. Previously, I had a background in artificial intelligence. I did my PhD at MIT and then did a postdoctoral fellowship at the Computer Science and Artificial Intelligence Lab. So was working in artificial intelligence before, and then also had a background in healthcare, doing biomedical imaging. So bringing the two together in dentistry with my experience that I'd had, we realized that there was a huge opportunity here to really improve care, ensure that the dentists are given the right technologies to provide the care that they provide as well. So started Overjet with some amazing people and was fortunate enough to get Bob and Shaju, Deepak, etc., involved in this company to make this happen.
Mm-hmm. So what are some of the key problems in dentistry that AI can help solve right now?
Well, we collect millions of data points with our patients. So take, for example, in 1 year, how many patients you see, all the metrics that you collect, all the information you collect. We collect a lot of data, but how often do we use it? We usually use it at the point of care. And maybe we won't see them again for another 3 or 6 months when they're in for a hygiene appointment for 45 to an hour. And then after that, we won't see them for another 3 to 6 months. And so we rarely utilize the data as effectively as we can. So by collecting this data, we need to use it in a more powerful way. Artificial intelligence could look at scale across the platform, look at all of the radiographs in the patient. So for example, a patient's coming in for a hygiene appointment. All that data is presented in an annotated radiograph. It also has other information on the dashboard that we provide for the clinician. And they can take a look at that patient, see what's there. All the information is gathered for them. It's collected. And then you can look at that patient and exactly see what conversations you might have with the patient. They may have a carious lesion, some decay in one area. You can point that out. Maybe it's been a while since they've had a periodontal charting. Maybe they're losing some bone, but they're coming in regularly for routine cleanings. But they may have an indication for, let's say, scaling and root planing because the bone loss has progressed to that point. That's the time to have the conversation with the patient. So it informs the dentist and allows them to help educate the patient about their needs for the right time.
Mm-hmm. So with that being available now, basically, what are some of the challenges where you're looking to employ AI to help improve dentistry in the future?
So in the future, I think we believe that there is a great opportunity to bridge the gap between medical dental, which is the medical dental integration. There's a lot being talked about, but finally we have the technology to be able to automatically create diagnostic or measure progression of disease, measure outcomes, and be able to really show the value of dental treatments as it compares to the health outcomes themselves. So I think that is something that we're very excited about working on currently, as well as in the future, to help ensure that not only are we improving oral health, but also overall health for the patients. And the second thing that we feel very passionate about is enabling access to lower cost care, ensuring that everybody has access to care, whether you're living in Boston or in a small town in Indonesia or some other place where you might not have access to the right dentist as well. So I think there's an opportunity right now to really utilize the data that we have to ensure the right care gets delivered, help support the diagnosis by the clinicians, and in the future be able to provide access to care to patients who might not have access to care, not have a dentist located in their small town or village.
Mm-hmm. Do you think that AI is going to change the way dentistry is practiced in the future? Are there sort of concrete things you think are going to look and feel different about the way practices work and operate? And, this is going to be due to the presence of artificial intelligence systems?
Sure. I mean, I think this is the most, in the entire time I've been in the profession, there are a few transformative technologies that come along that really change the way practice is delivered, clinical treatment is delivered. I don't think that this is one that will ever go backwards. This is a transformative technology. I'm convinced that the ability to identify information early enough and to be able to utilize that information to follow the patient's care prospectively so that you can follow their outcomes, especially for patients with stratified risk. If they have diabetes or cardiovascular disease or other risk factors, perhaps they smoke, you can actually look at these patients, follow their treatment, and see whether they're going downhill in a certain way, or maybe an increase in your disease rate, let's say periodontal disease, for example, and actually provide them better care, more frequency, maybe perhaps make the case to the insurers, and we'll get to the insurance side on the other side, about upscaling their increasing the frequency limitations, perhaps for patients that are at significant risk, that have non-communicable diseases such as cardiovascular disease and diabetes that are very impactful globally, and tie them into the risks that are for the non-communicable diseases orally, like caries and periodontal disease. And so I think once we start to practice in this manner, using the information for the patient's best outcome, I don't think there will be a way that this will go backwards, and that will be very transformative.
Mm-hmm. That definitely sounds promising. Currently, Overjet has solutions that are available for both payers as well as dental clinics. And I'd love to hear about what those solutions are and how the approaches differ for those two audiences when you're applying artificial intelligence technologies.
Yeah, so we have, for the practices themselves, we have two solutions. One is on the practice level, so being able to provide clinician decision support in diagnosis and communication to the patient, so the patient is better informed about their conditions, and then automatically treatment planning such that it increases the productivity of the dentist as well as their staff, and also to identify and analyze the data to provide actionable insights to what Bob mentioned, such that you're looking at, rather than you can actually look at prospectively and determine whether there is anything that is being missed or anything that you should be looking at that in regular care you might have not noticed before. And then we have products on the managerial side, especially for DSOs, where if you have say hundreds of practices, and now you're looking at chart review and trying to ensure that the right care is being delivered across your practices. It is a big undertaking for DSOs with that many practices, but with our solutions, they can actually review the data for all their practices very, very effectively. So every chart, every patient information, every provider's information gets reviewed and provided to the managers in DSOs, so that they can understand their affiliated practices and help ensure that the dentists in these practices, whether they require further training or whether they're doing a great job and they just need to be given kudos for that, being able to communicate with their practices more effectively as well. So those are the two solutions we have on the practice side. On the insurance side, our primary focus right now has been on utilization review, and that is reviewing claims and determining whether the claim meets medical necessity. And that has been a manual task, and providers might be very well aware that sometimes a claim gets denied, sometimes it gets accepted, and sometimes there's subjectivity involved in this analysis. And now they have to go back and appeal and make and try to provide more information because there was subjectivity in the decision that was made. And with our solution, there's more objectivity objectivity. There's more quantification and measurements that happen to help determine whether a treatment or claim meets the medical necessity criteria of the insurance company. And we can automate that process and improve efficiency such that claims are being paid out much faster rather than over a longer period of time. So in the end, both solutions are focused in such a way that the patient care improves, whether it is in the treatment that is being provided in the practice or the claims that are being processed, and the right treatments get paid out, and we highlight them, and they get paid out much faster as well.
And in addition to that, Noah, if I may add, from a clinical perspective, it makes the clinicians better at coding, and it reduces appeals. Because let's say, for example, you have a hygiene scheduled appointment, patient comes in, a lot of inflammation, maybe a lot of calculus. The hygienist says, "Oh, I'm not going to be able to get this done in 45 minutes or an hour. Maybe we should just schedule scaling and root planing." Dentist comes in, a lot of inflammation, let's say bleeding, a lot of edema. Okay, let's put in for scaling and root planing. But it may be that the bone levels, the loss of bone between the CEJ and the crest of bone, may not meet the criteria for scaling and root planing. Maybe they're relatively normal bone levels, but there's a lot of inflammation and swelling. Maybe there's a lot of tartar or calculus, but it may be all on enamel and not on root surface. And so there's another code for that other than 4341, which is scaling and root planing. And so rather than putting in that code, having it rejected, appealing on the patient side, back to the insurance company doesn't allow it. It's one of those things where you realize, oh, this may not be indicated. It's been identified in the practice as not having the criteria that the insurance company has for that code, and then you're actually applying the right code. Patient gets the administrated treatment faster, as Wardah had mentioned. So it makes them better coders, and it makes them more aware of how to apply.
So it definitely sounds like there are benefits on both sides of the equation here, but has one side of this been faster to embrace AI? Have the payers or the clinicians been more eager about putting this technology in place?
So the payers have been much faster to adopt, but the way to look at it is, what's the difference in business-wise between a payer and a practice? So an insurance company is a pure data company. They receive data, they analyze it, and make a determination based on the data. On the other hand, practices, dentists do so much more. They're not just data analysts. They're communicating with patients. They're doing procedures. They're diagnosing, etc. So it's very, it becomes very clear why insurance companies would adopt it faster, because they are a data analysis company, and if they improve that process, it brings a lot of value to them in improving efficiency and ensuring that they're doing an accurate review as well. On the other side, for dentists, this is another add-on into their current workflows. They're already doing so much. So although there has been very fast adoption, especially when you think about healthcare adoption, it has been much faster. However, insurance companies are doing it at a speed that is unheard of, especially when it comes to healthcare.
Mm-hmm. So with that rapid adoption on the side of insurance companies, is that going to drive clinics to kind of need to have some of this technology available to, I guess, overcome the challenges that you mentioned, Dr. Faiella, about you don't have the correct code, but you want to provide treatment?
Sure. And I think that's the most important part on the clinical side, because the clinician, as Wardah had mentioned, they're doing so many different things. They're making the diagnosis, they're examining the patient, they're overseeing their care, they're tying in their medical conditions with their oral conditions and seeing whether there's an impact there. And they have to explain all of this to the patient and offer the right treatment and have them understand why. And I think because there's so much to do, having that allow the clinician to be able to see in real time the exact needs that might be present. And it's still up to the clinician to apply their acumen, to really look at that and say, this is what the artificial intelligence platform allows us to see. And I've examined you, and this is what's needed. And it may be that they'll make a decision to watch a certain area. It may not have progressed. It may be if the decay is not through the enamel, they may elect for a remineralization process rather than go for restoration. So they can actually make those, they confirm the finding that the artificial intelligence provides. Because, somebody once said, machines are very fast but dumb, and humans are slow but brilliant. And so you need that clinical acumen. The dentist needs to apply that, his or her training, to allow for the patient and explain what the options are. And the patient can make the right choice, and they have a feeling of confidence that this is the right recommendation, and they're just not taking the dentist's word for the recommendation, even though they may trust them. They really want to know. And if they can see that, if the dentist shares the image, they can feel better about it.
And one thing to add here from my side would be, especially when it comes to what we're really excited about, is that for the first time now that insurance companies and practices can come on the same page. They don't have to be at loggerheads here, where the providers have no transparency on what the insurance company is doing. On the other side, insurance companies are doubting what the providers are doing. In the end, dentists have joined this profession to provide care to the patients and do so in the best interest of their patients as well, and making those decisions for them, or sometimes the procedures, etc., and hoping that the insurance company pays out the claim, which affects the patient at the end. And on the other side, insurance companies are of course they run, there is a business there that is being run as well. But if you look at, if you talk to the executives of these companies, and who are actually the clinicians involved on the other side as well, which are not there again to make more money, they're reviewing these claims in the best interest of the patient, and making sure that the right treatments are being conducted. I think there is this, there needs to be more transparency here. And this is we believe the technology, as well as what we're doing at Overjet, is bringing the two together and putting them on the same page, such that we take into account patient interests first, and make sure that both are aligned in providing the right care for the patient. And intentionally, both have the best intentions, but unfortunately, the way it has been set up currently, and the limitations of technology in the past, have not allowed such transparency, as well as such speed of making judgments available in the past.
Mm-hmm. The dental industry as a whole generally has a fairly slow rate when it comes to adopting new technologies. There's always the early adopters who jump in, but it doesn't seem to make its way through the industry for quite some time after it's been introduced. Is there a challenge when it comes to artificial intelligence in kind of winning the trust of the clinicians that this is something that can be a resource and a tool to help them provide better care?
Well, clearly, the first concern is they want to understand exactly what it is. I mean, it's a buzzword. It's everywhere now. In every industry, you see the word artificial intelligence, AI, everywhere. And how will it apply to me? How does it affect my position and my role? And they just don't understand how it works. And so a little bit of socialization into the practice first. You need to know exactly how this works. You take the black box apart a little bit, and you show them this is a tool that will help with your decision support for you to apply to the patient and explain. So the explainability of that AI will actually provide an ability to explain what the patient needs, really gives them some comfort that they know exactly how it's being done. We do everything we can do to be assured that it's bias free. We're showing clinical patterns that are identified by training images on upwards of hundreds of thousands, if not millions of images. And those patterns are recognized by the machine very quickly. The interpretation still is there for the clinician to examine the patient and interpret for the patient in terms of what treatments are necessary. There may be more than one. And so from that perspective, they start to have more of a comfort. When we present this to clinicians, once they see it, and that once they start to utilize it in a pilot, they really don't want to go backwards. They say, this is something that I can use on a daily basis. And they really find the value in it very quickly. So, and the same on the clinical side.
That would be, and a lot of the credit goes to dental schools too. Right now, dental schools have been adopting technology for their students at a pace that, it has not happened in the past as well, whether you have Harvard or Boston University really taking digital dentistry to the next level. And the students coming out are now exposed to technology at a rate that they feel that that's part of providing or very needed in providing the care as well. So I think not only are the current dentists seeing the value of it, but the future dentists are getting trained to use such technologies to provide better care. So I think there is some credit that needs to go to the dental schools and how they're training the future dentists as well.
Mm-hmm. Well, that I totally agree with. I recently did an interview like this with the NYU School of Dentistry just about that topic, technology in dental schools, and it does seem to point to greater adoption in the future. In terms of where we are at today with this technology, how good are these AI systems at reading radiographs if you were to compare them to, an experienced clinician who's been reading radiographs for a long time? What does the machine do that it's able, to do differently, and how does it compare?
So I'll talk a little bit about technically and let Bob answer the rest of it. But if you think about it, the amount of data that our machine learning models have seen is probably more than a dentist would see in their lifetime. So, our models have been trained on millions of data points. And if we made a dentist sit and just look at x-rays, that would take them a long period of time to learn from. Also, we take into input not a single dentist input, but consensus from multiple dentists. And at times it could go up to 10 dentists making consensus or making a judgment on one x-ray. And all that information goes in for training itself. So there is, an advantage here. We're not, taking the amount of data that we've seen, the amount of input that we've seen, the amount of learning that has happened. There's an advantage that machines have right now, and the models that we've built, which are very, very sophisticated and have, again, millions of parameters that learn to provide the output. However, there's also, we do not have all the information as well. So as the dentist, you could take photographs, etc., as well, and you could take the x-rays, but there's also, when the dentist is in the or is providing the care and is with the patient, there's all this other information that they're taking from the patient too. So I would not say one is better than the other. We do believe that this technology supports dentists in providing the right diagnosis and care. And at this time, this is how it should be utilized as well. But I'll let Bob talk more about, whether the clinical aspect of it.
Well, interestingly, the clinical aspect is where these machines are trained on upwards of millions of images, as Wardah had mentioned. And the interesting thing is it keeps learning. So feedback from the dentist, they have an opportunity in the dashboard to actually, if they see something that they feel is a little bit different, maybe it's not exactly what the machine learning had pointed out, maybe it's an artifact, they can give feedback into that. And the more data and the more input it has, the good thing about deep learning and computer vision is that it continuously refines the models. So the more information it sees, the better it is at recognizing these entities. And I think, that's the most exciting part about this, because it'll only get better. And with the adoption, people coming out of school today, they don't have any expectation that they'll do anything other than engage technology. And as they become mid-career dentists and then late career dentists, all of this will transfer right through. And that's where I think the projection of the escalation of using this technology across the profession really gets exciting, because it'll not only move through the profession as they go through the stages of their career, but it will also get better and better and better as people feedback and as the models improve as they do.
So this does sound to me like these are systems that rely as much on the expertise and training of the clinicians as they do on the training of the software themselves. Does this mean that clinicians don't need to be afraid that, these systems are going to replace them or replace their expertise or decision making?
Clearly not. I think, that's the most impactful moment for the clinician, is when they realize, I'm not going to lose my job over this. This is a tool that will allow me to be better at recognition, give information to me. It's almost as though And I've said this before, it's almost like you're a judge and you have somebody clerk for you. They give you all the information of the case, it lays it out for you, and then it's there for your interpretation and explanation for the patient. And they benefit from that. And they benefit in a much faster way than you can do it manually. And so that's where it gets really exciting.
Mm-hmm. Now, you touched on patients right there, and that's kind of what I wanted to conclude with is just, patients are obviously the reason why dentists are doing what they're doing. They're providing healthcare. How do patients realize the benefits from these AI systems? And is this something patients either will or need to know about, or can this all take place in the background while still providing patients with a path to better care?
So what we're seeing is that patients are getting better informed about their conditions. So say if you take a radiograph and the dentist, when they see a radiograph, they see so much in the radiograph. When a non-dentist looks at the radiograph, they just see gray, white, blacks. They can probably see a tooth if you showed them that that's a tooth, but they do not see the carious lesions, the radiolucencies present, there's radiolucencies everywhere. So you do need training to be able to read radiographs. And right now, when dentists are now explaining to the patient, hey, you need a particular treatment, they're utilizing that radiograph, which you need training to actually interpret, to communicate with the patient. And the patient has no clue and they're confused sometimes. They sometimes are not trusting the dentist, and other issues occur. So having a technology which can take that data and present in a better or in a better fashion any disease that is present, anatomy, measure X and Y, and present it to the patient in such a way that now they can understand, oh, you mean that spot here, you mean the bone levels is decreasing, and being able to now get better informed about their condition so they can make the better decision whether they feel that they should get the treatment or not based on the recommendation of the dentist. I think that's number one, and we're seeing that already happen, and dentists are also utilizing it as a communication tool with the patients. Number two is the real-time predetermination. So we're working with insurance companies and DSOs to enable real-time predetermination of claims. So when the patient is in the patient chair, rather than them not knowing whether the claim will be paid out or not, before the treatment is provided, a check is made in real time, and the patient can be better informed about their claim adjudication as well. And lastly, I think it's about ensuring that the right care gets delivered. Whether, as I mentioned, whether they're in Boston or in some small town, there is this technology that can help ensure that at least the right diagnosis treatment plan is being carried out, and then they can make the dentist can carry out the operations as well. So we do believe that this is a game changer for patients, and the dentist utilizing this technology to help improve the care for their patients as well is much needed right now.
From the patient journey perspective, let me say that, and I think we all know this, patients who don't come in as naive as they had been in the previous about their conditions, as Wardah had mentioned. They're not patients anymore, they're healthcare consumers. And they've consumed a lot of information before they actually walk through the door. And you'd be shocked how much patients know about their condition before you even make the diagnosis. They've read about it, they've talked about it with their friends, they've heard about it, they go online. Some of the information they get is scattered and they need a little interpretation, but I think they feel much more comfortable as they see AI in every aspect of their life. Autonomous driving cars, Siri, or anything that they use today has got some back end. Even when they go and they do a search in Google, it's all AI driven. And so those applications are not naive to the patient, and they see it now as helping them for their healthcare decisions. And I think that's the most exciting part about the patient journey.
Well, this is definitely a exciting area for the dental industry and healthcare overall. Is there anything I didn't ask you about that you really would like to share with our audience about AI technology or what Overjet has been doing?
Well, one of the things that we're excited about in the pipeline, and we're actually putting into implementation relatively soon, is being able to help dentists actually evaluate a practice before they actually make an acquisition of a practice. So for example, if somebody, let's say a dentist is ready to retire, maybe their productivity is dropping down, they're starting to maintain for their patients, they're keeping them safe and healthy, they're ready to retire, they're not really in a growth phase of their practice, they may feel that the practice value is not really as high as they think it might have been in the middle of their career. And what would that be worth? And I don't know what it would sell for to somebody else. You come in and you can find a whole new value for that practice if you can then apply the application and run at scale all the radiographs and all the information in the practice, and then find how many teeth have less than 50% remaining support, maybe an extraction, maybe an implant, maybe there's more missing and decayed and filled surface of the tooth, might be a crown in the future, maybe there's some borderline periodontal disease that needs to be addressed. And so you could look ahead, and just as a company would come in, use a financial expert to look at that present value of future cash flows for acquiring a company, now they're looking at the value of the practice prospectively rather than historically, which is what's always been done. And tie that in with maybe some information about the neighborhood, household income in the area, school system, real estate prices if they're buying the building. And now you have something that's really exciting for the purchaser of the practice and for the person transitioning. So those are the kinds of things that I think we're excited about, how you can expand it and some of the lateral applications we can see.
That is a very interesting and definitely innovative approach there. I think that's absolutely great. Well, Dr. Inam and Dr. Faiella, thank you so much for taking the time to join us today. We really appreciate it.
Thank you so much for having us.
Thank you,
It was a
Noah.
pleasure.
Thank you, Noah.